क्या कर रहे हो?
हाय।
हाय।
क्लास के पहले थोड़ी तैयारी तो बनती है।
बिल्कुल, ये देखो।
अरे सेल शीट है।
सेल शीट।
मैम प्लीज रिकॉर्डिंग स्टार्ट कर दो, आपका लाइव सेशन ही तो 2 बजे है।
बिल्कुल है, बट थोड़ा ताकत तो नहीं है,
एनर्जी तो चाहिए, कॉफी तो पी तो चाहिए।
So rotavirus vaccine was given at 6:40. ओह, इसको कट करो, इसको।
So we must remember.
ना नहीं, सागर मेरी लंच ऑर्डर किया क्या? बहुत भूख लग रहा है।
हाँ, एक कॉफी भी चाहिए होगी मुझे भी।
दिमाग नहीं चल रहा।
Yes. Waiting for your answers.
अच्छा।
Take this part again.
This again uses the strain SF1414 to only sorry, kill them.
So OPV is a live attenuated vaccine. अरे घर से फोन है। सागर 1 मिनट।
So ma'am, we are here together to take an integrated session on immunization. But I want to ask you something before we begin the session. Ma'am, tell me something. If a question on immunization comes in the exam, will it be counted as a pediatric MCQ or as a PSM question?
डॉक्टर नेहा, ये क्या है?
Vaccine.
So this is the BCG vaccine, which is given to newborns. Newborns are pediatrics territory. There's no confusion on this.
Huh? But ma'am, sorry to interrupt, but BCG is a part of a national health program, national immunization schedule, which belongs to us. It is definitely a PSM question.
Dr. Neha, how does it matter? Be it pediatrics, be it PSM. What is important is it is one of the most important topics for our NEET PG and FMG and INI-CET aspirants. Very, very important for them, for all of us.
Yes, you're absolutely correct. Let's make together the immunization easy for all of you. So here we are presenting to you the immunization masterclass.
So here, we are here to deliver some high-yield concepts you cannot afford to miss about immunization.
Yes.
So welcome to this session. I am Dr. Meenaskhi.
I'm Dr. Neha.
So let's start. So Dr. Neha,
Yes, ma'am.
immunization, vaccination, दोनों सेम चीजें हैं क्या? What do you think so?
बहुत ही अच्छा सवाल है मैम. This often comes as a viva question also. So basically immunization and vaccination are slightly different. Vaccination is the art of administering vaccines and immunization is the process once the antibody formation starts in our body.
Okay. So immunization से तो हमारे बहुत सारे questions आते हैं. तो immunization अगर हम करें या vaccination करें, vaccination is it active immunity or passive immunity? I want all the viewers to answer here. Immunization is active immunity or passive? A must know question and a very important concept.
Yes, and it's also confusing for the students sometimes. It has come also.
So, Dr. Neha, we all know, and I'm sure all the viewers have also answered by now, immunization that we do is definitely active immunity. है ना? So we are injecting the organisms, the inactivated form of the organisms, the toxoids, recombinant forms, and we are inducing the immune response of the individual. So it has to be active immunity.
Yes.
है ना?
Antibodies are formed in our body.
So, but passive immunity का कोई example दे सकते हो क्या आप? Passive immunity क्या लगता है?
जिसमें हम ready-made antibodies we inject in the body.
Okay. So, can our viewers quickly tell us कि पैसिव इम्यूनिटी के कुछ एग्जांपल्स क्या है? व्हाट आर सम एग्जांपल्स ऑफ पैसिव इम्यूनाइजेशन?
सो इम्यूनोग्लोबुलिन्स.
यस, इम्यूनोग्लोबुलिन्स है ना, बहुत सारे डिजीजेस में हम देते हैं. सो वी गिव टेटनस इम्यूनोग्लोबुलिन, हेपेटाइटिस बी का इम्यूनोग्लोबुलिन. सो दे आर एग्जांपल्स ऑफ पैसिव इम्यूनिटी, है ना. सो वेरी वेरी इंपॉर्टेंट कंसेप्ट. So
let's trigger your brain. So there's a question for all of you. For which of the following diseases active and passive immunization is not given together?
So क्या लगता है? रेबीज, आई एम श्योर डॉग बाइट का तो केस सिनेरियोज आपने सुना होगा, देखा होगा. यू मस्ट हैव कम अक्रॉस. हम अगर वूंड है अच्छा खासा, वी गिव बोथ द वैक्सीन एज वेल एज इम्यूनाइजेशन, इम्यूनोग्लोबुलिन्स ऑन द सेम विजिट, है ना. डिफरेंट साइट्स पे देते हैं बट वी गिव इट. टेटनस, अगेन अगर टेटनस है तो हम इम्यूनोग्लोबुलिन्स भी देते हैं
Yes.
एंड वैक्सीन भी देते हैं. मीजल्स का क्या लगता है?
चौथा ऑप्शन भी देख लेते हैं, हेपेटाइटिस बी. सो वी अगेन गिव द वैक्सीन एंड इम्यूनोग्लोबुलिन टुगेदर.
स्पेशली अ बेबी इज बोर्न टू हेपेटाइटिस बी पॉजिटिव मदर, तो आपको हेपेटाइटिस बी वैक्सीन भी देनी है बेबी को, इम्यूनोग्लोबुलिन भी देनी है एट डिफरेंट साइट्स यूजिंग डिफरेंट सिरिंजेस बट एट द सेम टाइम एंड एज अर्ली एज पॉसिबल आफ्टर बर्थ.
Yes. So the correct answer over here is measles. For measles, we cannot give the vaccine and immunoglobulin together.
राइट. सो क्या टाइप्स ऑफ वैक्सीन होते हैं? कई बार वाइवा टेबल्स में आपको कोई भी वैक्सीन पकड़ा देंगे, है ना? से फॉर एग्जांपल द BCG वैक्सीन, एंड वन ऑफ द फर्स्ट क्वेश्चंस इज व्हाट काइंड ऑफ वैक्सीन इज इट? सो व्हाट आर द डिफरेंट टाइप्स ऑफ वैक्सीन?
So this is in fact a third year MBBS question also, as well as your MCQ questions. So like you all know, there are majorly, we divide them into live vaccines, killed vaccines, subunit vaccines and combination vaccines. So the first one that you can see on the slide as well is written live attenuated vaccine. So what do we do over here? We inject live organisms into the body but not in its full virulence. We inject it in attenuated form. What is the meaning of attenuation? You know, attenuation was once asked in INI-CET exams also earlier when it used to be AIMS. So attenuation means we have reduced the virulence or killing power of the organism, but we've injected it in the live form.
But having said that, it is a live vaccine, so
Yes.
of course we cannot give it in immunocompromised.
Yes, we cannot even give it in a pregnant female. Okay. So another question that comes up, the example. So as you already might have gone through the videos, we have always given you a mnemonic with such type of questions. So the mnemonic, like you can see over here, I love chick embryo. I stands for influenza in the live form. Love stands for live vaccines. Chick again is chickenpox. EMBRYO. E is Japanese encephalitis live. M is measles. B is BCG. R is rotavirus. Y is yellow fever. And O is OPV vaccines. All of them have been written for you as well. But what is the other form? Killed form. Killed means we're going to kill the organism. We can kill it with chemicals, with heat, and inject a killed organism. So what are the examples? KILLED is your mnemonic. K is KFD. I is again, if you see IPV, which is the killed vaccine. L is influenza killed. J, E is Japanese encephalitis killed. And D is, it's not a vaccine. It's A for apple, B for ball, C for cat, D for dog. So dog bite, rabies. And trust me guys, rabies vaccine is many times asked. Earlier it was like a simple question, rabies is a live killed whatever, so we used to mark killed. Now they will give you a question, a pregnant female is going, she's been bit by a dog, what are you supposed to do? So now you all know rabies is a killed vaccine. Without any hesitation we have to give it. Any which ways ma'am, rabies has a case fatality rate of 100%.
Absolutely.
So those are your killed vaccines.
So killed vaccines have the major advantage that you can give them in immunodeficient individuals very, very safely. But of course, the immunogenicity is not as good.
Yes.
Now, one more question that was asked recently in the INI-CET exam, that in which of the following immunodeficiencies can you give this live vaccine? So, in most of the immunodeficiencies like severe combined immunodeficiency and other forms, we do not give live attenuated vaccines. But complement deficiency is one condition where we may give live attenuated vaccines as well.
Yes, that's something you should remember. It's a golden point.
So moving ahead, there are two more types of vaccines. So toxoid vaccines. What do you mean by toxoid vaccines? So toxoid is coming from the word toxin. So these are basically inactivated forms of certain toxins.
Yes.
So we know diphtheria has a toxin, tetanus has a toxin. So diphtheria and tetanus are examples of toxoid vaccines.
Yeah.
And recombinant vaccines are again there. So one very important example that we've been using for now, years and decades together is the hepatitis B vaccine. Can you tell us another recombinant vaccine, a newer recombinant vaccine, which is going probably to be soon introduced in our national immunization schedule? So waiting for the viewers to answer in the comments below. So which other recombinant vaccine do you think is, available now and is going to be introduced in the national immunization schedule soon?
Or, we can put it another way also, just to tickle your brain a little. If somebody asks you which is the most common cancer in India and worldwide, breast cancer,
no doubt.
But if somebody asks you which is the most common cancer in rural India,
then of course it is cervical cancer.
So as ma'am said, I hope you've given your answers by now. The HPV vaccine is a recombinant vaccine which in due course will definitely be introduced in our NIs.
Another question, Dr. Neha, in the INI-CET exam, so they are not just now asking about the vaccine types, they go one notch higher, AIMS hai, PGI hai, so obviously. So, there was a question that hepatitis B, we all know it's a recombinant vaccine, but which antigen is there in the hepatitis B vaccine? Hepatitis B ka which antigen is there in the hepatitis B vaccine?
So, the answer was hepatitis B vaccine is prepared using HBsAg, hepatitis B surface antigen. That is your, like NEET PG FMG exams, they ask the type of vaccine. Like ma'am said, that hepatitis B vaccine is prepared using hepatitis B surface antigen. That's your potential MCQ for next time they can ask you in NEET.
Yes,
the similar way.
Absolutely.
Okay.
So, now, you must have heard about some conjugate vaccines and polysaccharide vaccines. So, can you give me an example of a conjugate vaccine that is there in the National Immunization Schedule? So, by the time you write your answers, let me tell you a little bit about them. So, conjugate vaccines are the vaccines which have immunogenicity even in less than 2 years age. So, they are thymic independent vaccines and they induce a longer, immunity and lifelong immunity. So, they are better immunogenic. So these are the vaccines which can be given in less than 2 years of age, and there is an example in our National Immunization Schedule.
So yes. Let me show them only. Like ma'am said that, look over here, what do I have? This is pneumococcal conjugate vaccine. So pneumococcal conjugate vaccine, the conjugate component is recognized in the body below 2 years, not the polysaccharide. So in your NIS, which is the one that we use, pneumococcal conjugate vaccine.
But pneumococcal polysaccharide vaccine is also available. It is a 23-valent vaccine and it can be given only beyond 2 years of age, and we give it only in high-risk population, right? So not in less than 2 years age, right? So,
okay, so ma'am, again, like as you can see on this screen already, but there's a very commonly asked MCQ that can 2 live vaccines be given together? True or false?
So waiting for our viewers to answer, but of course, live vaccines, we can give any number of live vaccines on the same day, right? But we have to give them at different sites, right? And if not given on the same day, then a gap of at least 28 days should be there between 2 live vaccines. It's not like, you went for an immunization visit, one of the live vaccines you gave that day, the other one was not available, you give it 1 week later. We cannot do that.
We cannot do
so either give 1 or more live vaccines on the same day, or maintain a gap of at least 28 days between the 2 doses.
Yes, and if you give it on the same day, you have to give it at different sites. Like we're going to do the NIS also, so there you will be seeing at 9 months 2 live vaccines are given together but at different sites.
So yes, as Dr. Neha said, the recommended spacing between 2 live vaccines is 4 weeks. So either give it on the same day or maintain a gap of at least 4 weeks.
Yes. This is a very golden point, guys. These are the types of conceptual questions that are being picked up right now in your exams.
So now coming to the routes of different, administration of various vaccines. We know there are some oral vaccines. So oral vaccines, we all know an example.
Let's give you oral vaccine over here. As you can see, which is the most common cause of diarrhea in infants?
Of course, it is rotavirus.
So here we have the rotavirus vaccine for you, and like ma'am said, rotavirus vaccine, it's given by oral route. Any other vaccine in your NIS which is given by oral route?
Come on, quickly answer in the comments.
और आपको पता है अमिताभ बच्चन also says डैश की 2 बूंदे जिंदगी बचाती हैं.
Absolutely. So 2 बूंद जिंदगी के.
2 बूंद जिंदगी के. So which one he is talking about? OPV. Alright, so orally in your NIS, we're giving OPV 2 drops and rotavirus 5 drops. We will tell you when they are giving as we proceed in the session.
So absolutely. Now coming to the injectable vaccines, there are different, ways or routes of injections.
Yes.
So we have the intramuscular route. So nowadays, instead of just directly asking that what is the route by which this vaccine is given, you may get an image-based question. So if you see that the injection is at 90-degree angle to the skin, then of course it is an intramuscular injection. If the angle is around 45 degrees, it is subcutaneous injection. And how do you recognize intradermal injection, Dr. Neha?
Yes, if the angle is almost 10 to 15 degrees, then we say it is intradermal injection. And we cannot mess up the angles, okay?
So, there's an interesting fact that most of the vaccines in our national immunization schedule are intramuscular,
yes,
except some live vaccines. Yes, So what are the live vaccines in our national immunization schedule that are given by the subcutaneous route?
And both are given at 9 months. Try to recollect. So ma'am, I think one is measles.
Yes.
MR1, the first dose, and of course the Japanese encephalitis live is also given by subcutaneous route, and both are given at 9 months.
Absolutely. And can you name the only intradermal vaccine that is a part of our national immunization schedule? No, but now we have one more.
Yes.
So we have two actually.
So the first one is given at birth, which is your intradermal route, which is BCG vaccine, and the other one is given at 6 and 14 weeks.
Can you guess what is that?
Yeah.
Let's wait for the viewers to answer.
For the viewers.
Yes. So meanwhile, let us move ahead with the vaccines included in national immunization schedule. So many times, there have been a question in the NEET PG. All of the following are given at birth except. So very, very important to know which of the vaccines are given at birth. So we know they are BCG, Hepatitis B birth dose, and OPV zero dose. Yes. So let us take up the vaccines one by one and discuss a little bit more about
Yes,
them.
and for any vaccine, guys, you should always study under the following headings, as you can see over here. The name of the vaccine, of course, you should know the strain also. What is the schedule? What is the dose? What is the route? What is the site? Any adverse event, contraindication, those should be compiled when you talk about a vaccine. Now, which one is this? The one that I've taken out. Now, as you can see, this is something which is sensitive to light. So which is this? This is a BCG vial.
How do you recognize it is sensitive to light? Yes. Can you see the color of the vial? It is amber color. It is not transparent, so that it does not get destroyed by light.
And any other vaccine which is a potential viva question, which is available, which is light sensitive
and has an amber colored vial or ampoule? Yes. So I am sure you must have seen measles vaccine.
So remember, both BCG and measles are light sensitive. Now another thing, BCG vaccine, as you all know, is a reconstituted vaccine, right? It comes in powdered form, and this is the diluent. Another MCQ which comes in exam, the diluent which is associated with it. So this, as you can see, sodium chloride, and we have to reconstitute it, and once reconstituted, it has to be used within 4 hours. That means it does not follow the
open vial policy.
Exactly.
So any reconstituted vaccine, remember, they do not follow the open vial policy, and you have to use them in the same visit, that is within 4 hours of reconstituting.
Let's give them the names also. Another one, as you know, measles, where the diluent is sterile water. Also, you have Japanese encephalitis live, where you have the phosphate buffer, and you have yellow fever called physiological saline.
So all these vaccines do not follow the open vial
policy. So what are the vaccines that follow? That means which could be reused up to 28 days, provided they are maintained in proper cold chain, the expiry date has not crossed, VVM has not expired,
and all aseptic precautions have been taken for withdrawing the vaccine. The vaccine vial septum has not been submerged in water, and the date of opening the vial should be clearly mentioned on the vaccine vial.
For that also we have a mnemonic, all T series vaccine plus PIO, PO plus J killed. So T series means all those vaccines which have letter T. And now rotavirus is also following open vial policy. Rotavirus, Penta, DPT, Hepatitis, TT, TD, all of them. PIO, PCV, IPV, OPV, and of course Japanese encephalitis killed which are all updates. Ma'am, one more thing, this time in FMG exam they gave a question that baby is not formed the scar post PCG vaccine. So the woman has come to the health center. What has to be done now? Should you revaccinate the child with BCG? What has to be done?
So after giving a BCG vaccine, it is the normal sequence of events that first there will be formation of a vesicle, then a papule, an ulcer, and finally in 6 to 8 weeks usually a scar is formed. But even if a scar is not formed, you need not repeat the BCG vaccine. So you just reassure, and repeating the dose is not required, right?
Yes.
So what is also important is some of the important adverse effects of BCG vaccine. So BCG vaccine, we know what kind of vaccine is it? Live attenuated. So it can cause disseminated BCG infection if you give it accidentally in an immunocompromised child.
Yes.
It can cause subcutaneous, it can cause BCG lymphadenitis if accidentally it is administered subcutaneously. And it can cause osteitis. So a lot of problems can happen if it is not given properly, right?
Yes, absolutely. And so now coming ahead with the NIS, what are the other vaccines given at birth? Like it's written, Hepatitis B vaccine, which ma'am is showing.
So hepatitis B, you can see a transparent colored vial. So it is not a light sensitive vaccine. We already mentioned it is a recombinant vaccine. So it should be given as soon as possible after birth. Nowadays, in fact, most of the NICUs, they've made a policy that at birth, just like you give another injection, what injection do you give at birth to all the babies? Yes, that's not a vaccine, of course, but that is vitamin K.
Vitamin K.
So along with vitamin K, now, they are recommending that hepatitis B vaccine should be given as soon as possible after birth. Because many a times it happens that unbooked pregnancies are there. We do not know the hepatitis B status of the mother. So this hepatitis B vaccine birth dose goes a long way in protecting those babies from, transmission of hepatitis B virus from the mother to the baby. Right?
And if not given, then it should be given within 24 hours. And like it's written, it's given by IM route. All T series vaccine, guys, go by IM route on the anterolateral side of mid thigh, left. Okay. Another one, like we discussed, OPV, 2 drops of oral polio vaccine given by oral.
And it is a live attenuated vaccine, right? And not just for the baby. The OPV vaccine is very, very important for a community health expert also from the public health perspective. So I'm sure Dr. Neha will agree on that.
Exactly. So what ma'am is getting at is that the concept of herd immunity. Now, what is herd immunity? By vaccinating a larger proportion of children, we also offer protection to those whom the vaccination has not reached. And for OPV, it is one of the best examples that follows herd immunity.
Another very important question that has come in the INI-CET exam earlier is, there's a child with nephrotic syndrome.
Yes.
So what will you do? The immunization of siblings of an immunocompromised child is also important. So if there is an immunocompromised child in the household, so maybe primary immunodeficiency, maybe a child with nephrotic syndrome on steroids, so you have to make sure that you do not give OPV vaccine to the siblings staying in the same household. Because, as ma'am said, herd immunity is there, and that vaccine virus, the live virus, can get transmitted to the immunocompromised child and cause the disease. So we will avoid giving OPV vaccine even to the siblings of an immunocompromised child. Right?
Alright, so the next vaccines, like we know, after birth is given at 6, 10, 14 weeks. As we've discussed potential questions from OPV. So we have OPV 1, 2, 3. Remember, these are the primary doses. The live vaccine which needs primary doses to confer immunity, one answer is OPV. And of course, we give pentavalent 1, 2, 3. Now, ma'am, another question. From pentavalent, you all know it is a combination vaccine. So the MCQ is, what are the diseases it is protecting
of course,
from?
it is pentavalent. So it has to be 5 diseases.
5 diseases.
So what are the diseases? So they are diphtheria, pertussis, tetanus, that means DPT. Apart from that, there is hepatitis B and Haemophilus influenzae. So we have 5 diseases against which it protects.
And please remember one thing, in this the pertussis is given as the whole cell component, not the acellular pertussis that we are using in the NIS. So this is the pentavalent.
So also we already discussed about the pneumococcal conjugate vaccine. So only conjugate vaccine can be given less than 2 years of age. So we have 2 doses of pneumococcal conjugate vaccine in the primary immunization schedule. So at 6 weeks and 14 weeks, followed by a booster at 9 to 12 months.
And remember, it is given at right thigh. Because on the left thigh, we are giving by intramuscular route the pentavalence. So over here, it's given in the right thigh.
So because at 6 weeks, so many vaccines. So can someone quickly write in the chat box, what are the vaccines that are given to a baby at 6 weeks of age as per the National Immunization Schedule? Yes? Waiting for your replies. So meanwhile, moving ahead, we also have a rotavirus vaccine, which is given at 6, 10 and 14 weeks. We already saw the oral rotavirus vaccine, right? And ma'am, can you tell us one important adverse effect? So many times asked in the NEET PG exam, FMG exam.
Of course, it's like a patent MCQ of all the exams. We all know intersusception is one of the most commonly asked adverse effects associated with rotavirus. So next time they can ask you that any baby who has a history of abdominal surgery, which is the vaccine you will not give, so rotavirus vaccine will not be given in that case.
So now this inactivated polio vaccine is also a part of the National Immunization Schedule, we all know. So previously it was recommended to be given intramuscularly, but in the National Immunization Schedule, we are using a smaller dose. We are using fractionated IPV and it is given intradermally. So Again, there were 2 doses recommended at 6 weeks and 14 weeks. But very, very recently, in Jan 2023, now a third dose of FIPV is included in our national immunization schedule at 9 months of age.
And that is a primary dose, not a booster dose. Another question that could come, what is the meaning of fractional in FIPV? So fractional means 1/5 of the full dose. Full dose is like 0.5 ml, so 1/5 means 0.1 ml.
And do you know why we are giving this fractional dose? So, there have been studies that, even with 0.1 ml dose given intradermally, the immunogenicity is same as what you give 0.5 ml intramuscularly.
Yes.
So, with a smaller dose, we can achieve the same benefit. So, we can vaccinate more number of children using this same IPV vial. So, that is why,
cost
yes,
effective.
of course. So another vaccine that is there in our national immunization schedule, an important one, a live vaccine, the measles rubella vaccine, MR vaccine, which is recommended. The first dose is recommended at 9 months of age, and the second dose is there at 16 to 24 months. So, do you know a situation where, you can give MR vaccine even before 9 months of age, Dr. Neha?
Yes, exactly. So that's a potential question also. MR vaccine can be given. See, first 6 months not at all needed because from mother the antibodies are there. However, the antibodies decline from 6 months onwards. So situations where it can be given between 6 to 9 months is if there's an outbreak of measles reported, then all the children who are between 6 to 9 months should get. And also in cases of PEM, we can give measles vaccine between 6 to 9 months.
But important thing to remember, and has come as a previous INI question also, if you were to give, the vaccination, the measles vaccine, say at 7 months or 8 months of age because of an epidemic outbreak, the important thing is that dose is not counted.
Yes.
You still have to give the first dose of the measles vaccine at 9 completed months.
So that is a supplementary dose. Please remember, supplementary doses will never replace the routine dose. However, if the gap is very close between supplementary and routine, then you should maintain at least a gap of 4 weeks between the 2 doses.
Absolutely.
So moving ahead, what is the other vaccine which is given at 9 months? So it is the JE first dose, and the second dose of Japanese encephalitis is given at 16 to 24 months. Now earlier, JE was only available as live JE, which was SA1414 2 strain. However, now India has introduced the JEV vaccine, which you can see over here. This is killed JE, guys. This also uses the strain SA1414 2, however in the killed form. So this is now being introduced in your schedule. And the question which is to be remembered, live JE was given, as we discussed, by subcutaneous route, but the killed JE vaccine is given by intramuscular route. That is very important. And the other thing, live JE would not follow open vial policy, but the killed JE vaccine follows open vial policy. And ma'am, no, JE vaccine is not given throughout India.
Of course, it's given only in endemic districts, endemic areas like the states of Uttar Pradesh, West Bengal,
Assam. So those are the states. And at 9 months, along with measles vaccine, what do we give? We give vitamin A. So at 9 months, it is given 1 ml or 1 lakh international unit. Thereafter, every 6 months till 5 years of age, 2 ml or 2 lakh international unit.
So it is often asked in table vivas also, and sometimes in MCQs. So vitamin A we are mentioning along with vaccines. So do you think cold chain is required for vitamin A storage and transport?
Very good question. Do you think cold chain is required? So please remember, we don't need cold chain condition, which is +2 to +8 to store vitamin A. You can just keep it away from direct sunlight. That's also an amber colored bottle, alright, which just has to be kept away from sunlight. And one more thing, we get a white color spoon along with vitamin A to administer the right dose. We can't use a table or a teaspoon for that.
Absolutely.
We have to use that white color spoon. If we don't have that, we can use the cap of the bottle.
So vitamin A, of course, the dosage less than 1 year is 1 lakh units. Beyond 1 year with a child weighing more than 8 kgs, the dosage would become 2 lakh
2
units.
lakhs. Yes.
So now coming to children at 16 to 24 months. So there are multiple vaccines to be given, essentially the booster doses. So you have the first booster of DPT, you have MR vaccine second dose, OPV booster, and Japanese encephalitis second dose in the endemic districts, right?
Yeah, one more thing to be noticed here. See, pentavalent is can be given till 1 year. So pentavalent had DPT, right? After 1 year we can't give. So now what have we written over here? At 16 to 24 months, DPT ka first booster. And
when do we give the second booster for DPT?
5 to 6
So
years.
5 to 6 years, right? So 5 to 6 years we give the second booster of DPT. And 10 and 16 years previously we used to give tetanus toxoid. But abhi kya dete hain? What do we give now? So we give TD, capital T, small d.
And remember one thing, as ma'am pointed out, if there is a question on NIS, like a question comes 10-year-old school-going boy or girl, what will you give? TD. But if a question is on trauma, some person has suffered a crushing injury or something, in that case, trauma cases, that is your TT vaccine. That will also help you to rule out the options.
Of course. So these were the vaccines in the National Immunization Schedule. Now quick recap of the sites of vaccination. So we know there are 2 oral vaccines, so oral polio vaccine and the rotavirus vaccine given orally. And of course vitamin A, not a vaccine but tagged along with the immunization schedule, given orally.
Yes.
The most important vaccine whose site you must remember is the BCG vaccine, which is given in the left upper arm. And in table vivas often there's a question that why do you give the BCG vaccine in the left upper arm?
Yeah, can we give it on the right upper arm? Why only left upper arm? So, of course we can give it, but it's to maintain uniformity in India so that the health workers know they have to look for the scar in the left upper arm. So that is why, to maintain uniformity in India, it's given on the left upper arm.
Of course,
right?
Yeah. So you cannot be looking all over the body searching for the BCG scar. So there's a standard place, left upper arm, where you look for. So right upper arm, what are the vaccines we give? So we often give the measles vaccine or the MR vaccine in the right upper arm, and also the IPV vaccine, which is also given, FIPV vaccine given intradermally. Now anterolateral aspect of thigh, the right thigh we give the pneumococcal conjugate vaccine, and the anterolateral aspect of left thigh, the rest of the intramuscular vaccines, which are the hepatitis B bird dose, the pentavalent vaccine, and the DPT booster.
Remember, all the T series vaccine, of course, other than rotavirus, because that is given by oral route, are going in the anterolateral aspect of the left thigh. Okay, now since we're talking about public health as well, we all know it's associated with programs. So what is the program which is focused on achieving immunization coverage in India? It's Mission Indradhanush. It was started way back in 2014. Since then, there have been a lot of revisions. The currently Mission Indradhanush, a potential MCQ, ma'am, covers how many diseases? It protects a baby from how many diseases? So your options could be 9, 10, 11, 12, 13, whatever. So please remember, it protects from 12 diseases. Okay, it protects from 12. You can count later from NIS also. But in case they trick you by asking pan India, so will it be more or less? Of course it's less, because throughout India, JE is only given in endemic this thing. Alright, so it will become 11 diseases. So Mission Indradhanush is currently focusing more on dropouts and left outs. Dropouts are the children who incompleted vaccination.
So partially immunized children are essentially dropouts, and completely unimmunized children are left outs. And we know, as per the latest NFHS data, the immunization coverage in India is still, 76%.
Yeah, there are major challenges which you go to the ground level, you will come across reasons why people are not vaccinating, but we are slowly getting towards it. The health ministry, everybody is involved in achieving more immunization coverage, and I hope it will increase with time.
Of course. So immunization is one of the most cost-effective public health initiatives apart from breastfeeding, which can, bring down the infant mortality and child mortality in a big way. And of course, needless to say, it is a very, very important topic for all our viewers, the NEET PG and the FMG and the INI-CET aspirants, a very, very important must-know topic.
Yes, so I hope that we together have tried to make this topic easier for all of you guys. Definitely go through immunization before your exams. 1 or 2 MCQs definitely comes from this topic. Thank you so much for attending the session. Hope to see you soon.
Thank you.